In the early 80s, New York State Department of Health did a study assessing the medical needs in the communities in Western New York. And actually, they determined that Black Rock Riverside area was medically underserved. Why was that significant? Because this qualified this community to actually pursue some federal funding to actually look for resources to build a healthcare clinic, so that the staff of the Northwest Buffalo Community Center, along with board of directors and community activists, started to put together a proposal to actually pursue some of these funding.
There was a group of community activists and residents of the Black Rock Riverside area that saw the need for medical care in this area, that there was total lack of it. There was no medical care in Black Rock and Riverside. You had a couple one doctor offices that worked out of their houses for many, many years. And I think that dwindled to about nothing. And you had to travel outside the area to get any kind of medical help, or relied on Kenmore Mercy Emergency Room or Children's Hospital Emergency Room.
Through a competitive process, the federal government had narrowed the process down to 3 actual applicants. And this will actually show how competitive the process was. The 3 finalists were Northwest Buffalo Community Center, to our surprise, the Bronx in New York City, and Puerto Rico. So you looked at it, we were a small fish in a big sea when it came to the application process. And that was just, for this community, surprising that we're even being considered. We actually had a lot of political things going on at the same time. We had a mayor who had been around for a long, long time, James Griffin, who was unique. One thing about Jimmy Griffin that we knew was that he spoke his mind. So during the presidential, James Griffin threw a curveball on everyone and endorsed Republican Ronald Reagan. So it really surprised a lot of people. Even in today's standards, you think if a Republican and a Democrat just don't endorse each other, but if anyone knew James Griffin, that was how he rolled. But why was that critical? When we found out that we were one of 3 possible candidates, and of course the other 2 candidates in the applicants were much bigger and actually had lobbyists and so on and so forth. So we felt like an underdog right out of the gate. James Griffin, he actually made a call to the president's office and talked to Ronald Reagan and said, is there any way you can throw your support? And Ronald Reagan, being the man that he was, pretty much said, I could see what I could do and at least give, an endorsement to you, not guarantee that you get the application. 3 months later, we got notification that we were the recipient of the grant.
My history with the Northwest Buffalo Community Healthcare Center began in 1993. It started as fulfilling a public health service obligation I had as a result of scholarship for medical school. And I began as the primary OBGYN here. And over the course of a number of years, we expanded with nurse practitioners, midwife, and in 1997, we recruited Dr. Michelle Freck and Dr. Judine Coggins. And the practice really expanded. The obstetric practice expanded, and as a result, the pediatric practice also expanded. During that time, I absolutely loved my time here. We had a very diversified patient population. Because of its location, we took care of many patients who were marginalized or on the fringe. But at the same time, because we weren't too far from some of my colleagues from the university and from professional areas, we had some of Buffalo's very famous names coming here. And it was my dream whether it was the health center's dream or not. I really thought that people who have a lot should see and help people who don't have as much. And that was really coming to fruition during this time period. The health center, and I think this was also the purpose of most of these health centers at the time, was to provide health care for people who had many barriers to obtaining health care and to provide good health care. Neighborhood health, what it is now and what it was, has always been dear to my heart because it does include everybody. I mean, you did not turn anyone away. And you, one of the beauties of the whole concept of the health center, even back in the 90s, and we would have people from the community who actually started to work for us. And there was at one time, I don't know if it still exists, there was like a closet of gently used business clothes that we would help to train people and not only help them with their health care, but help them with their social issues. And because they now had jobs and they had some income, they could move on with their life in other ways. Unfortunately, many of the people we trained that went on and got different jobs, but I guess their success and our success was the fact that they were able to move on and get different jobs. But so it became more than just a healthcare situation. It became a total life care. I mean, we had social agencies here in this office in this building, which was the first site. You also have a lot of social agencies from the community, and quite often the two groups interacted fabulously, and we referred people back and forth to each other. And it just seemed like it was an ideal situation to hopefully improve the quality of lives for a lot of people.